11 Alive News at 5 p.m. starts now.
First at 5, the CDC has issued an alert this week warning people that RSV cases are on the rise here in Georgia. Good evening and thanks for being with us. I'm Jennifer Bellamy.
And I'm Faith Jesse. So as families work to protect their kids against the respiratory virus, Metro Atlanta doctors are waiting to get their hands on a newly approved RSV shot for kids. 11 Alive's Brittany Kleinpeter is live outside the CDC headquarters. So Brittany, how do Georgia cases compare to other states right now?
So in an alert sent earlier this week, the CDC said Georgia was leading the southeast region in hospitalizations as it relates to RSV. And while there's a brand new RSV shot to prevent infants getting this disease, many pediatricians I spoke to said it's a waiting game to get it.
Oh, look at your ears next, buddy.
The Centers for Disease Control and Prevention is sounding the alarm, saying people are catching RSV at rates it's never seen before.
What's unusual is that we're seeing these cases in the summer when they typically don't show up until fall and winter. Good job. Wow.
That's why pediatrician Dr. Jennifer Shue is working to get the newly approved RSV shot in her office.
Anytime we have something where we can protect our youngest patients, we really welcome it.
Just last month, the CDC officially recommended Beyfortus to prevent RSV in infants. It's the first antibody shot of its kind.
And so my patients the parents are saying that they want to know when their kids can get it.
And that remains the question as the number of RSV cases increase and cold and flu season nears.
All right, let's just do a mouth shot then. I think we're going to be done.
When 11 Alive checked in with the Georgia Department of Health on the shot's status today, the department said it's still waiting on information for when it will be released at county or state clinics, adding the private sector could get it sooner. Dr. Shue says she was told the shot should be in her office by the end of the month, but she says the cost may limit other offices from carrying it since a single dose can cost hundreds of dollars.
For us, realistically and practically speaking, we're not going to order thousands of dollars in vaccines if the insurers won't pay for it or if the patients can't afford it.
Earlier this year, a vaccine became available for older adults, 60 and older, to treat prevent RSV. And the CDC, in that statement they released earlier this week, said it's an exciting season because this is the first year that we will ever have prevention tools for the most vulnerable populations. Guys.
All right, Brittany, thank you so much. Hopefully we can make it affordable for everyone to get it. So we know protection against COVID-19 is a big priority for people as we enter the fall season where illnesses can spread easily. The FDA could greenlight the updated vaccine from Pfizer and Moderna as early as tomorrow. Now remember, the decision would then need to go to a CDC advisory committee, and then the director needs to sign off on it. And it's important to note that the cost of vaccines is no longer being covered by the federal government, so you will need insurance to cover it.